Welcome to Facing Inward, where patient experiences become shared wisdom. This podcast is a space for candid conversations with patients, caregivers, and healthcare professionals who believe that every story holds the power to heal, educate, and inspire change. Whether you're navigating your own health journey or seeking to better understand the human side of healthcare, you belong here. And now your host, Melissa Carter.
If you've ever left a doctor's appointment feeling smaller than when you walked in, questioning your memory, your pain, or even your sanity, well, you're not alone. I've had moments in my own health journey where I wondered, is it me? Am I overreacting? That quiet erosion of confidence is something so many patients know intimately. And today's guest has put language and strategy around that experience. Ilana Jacqueline is a patient advocate and rare disease patient and the author of Medical Gaslighting: How to Get the Care You Deserve in a System That Makes You Fight for Your Life. This isn't just a book about what's broken, it's a practical guide for how to walk into the exam room informed, prepared, and empowered, especially in a system that too often dismisses women's voices. So, Ilana, I know that gaslighting is a standard term used, but for a lot of people, they may hear it, but not quite understand what it means. So, do you mind explaining to them?
Yeah, I would love to. And I can go into like the main explanation, and then we can talk a little bit about some of the phrases that might kind of light up in your head when you think
Sure.
about medical gaslighting.
Absolutely.
But the definition, medical gaslighting is the act of a healthcare provider dismissing or ignoring a patient's concerns or complaints and leaving them without a clear treatment plan or diagnosis. And they often are doing that by stating that the patient has an unspecified mental illness or they're exhibiting an unnecessary amount of caution.
Let me give you an example. I feel as I've gotten older, now I have a chronic illness, so I do have specialists who treat me very well. But when it comes to just, for instance, sinus issues, I had some sinus issues shortly after COVID, some of it spawned by COVID. And
Mhm.
I went to several ENTs, still have not found one that I love. But I felt like because I did not have the best insurance because I'm a freelancer, and
Mhm.
because I was a woman in my 50s, it wasn't just the first visit I had, but when I had to go to my third doctor because they nobody was quite treating my symptoms, I felt like, wait, something is happening here. And so is that kind of an example, or is that something completely different?
No, I think that's part of it. And first of all, congratulations and good on you for getting to your third doctor,
Yeah.
because that really is the remedy to medical gaslighting is not giving up. It's making sure you get the answers that you need. So I'm glad you got there, or if you haven't gotten there yet, you're still getting there and not giving up. Potentially it could be, it depends on what happened in those appointments that made you say, "You know what? I think I'm gonna go to someone else." Do you wanna dive into a little bit of what you experienced during those sessions that made you think, "I'm
Sure.
not being
Yeah,
heard?"
and I'm not gonna get into the weeds, because I don't want it to be boring, but it basically there was, pressure and swelling in my head that I thought initially was associated with my ears, but it may be more glandular, right? And I
Mhm.
just kept letting them know about the certain space in which the discomfort was coming from. And it seemed like they were doing everything but going to that specific place. They were doing everything but taking a scan or doing anything. And I will say, Alana, that as a kidney transplant recipient back in the day when, fortunately, when I had that done, I was in a solid professional position. I had solid insurance, and I can see the comparison of having like this plan that doctors love and then coming in with a lesser than plan that only I can afford, right? I think that even if I was the same age, I would see a difference. And I'm not making that up. But I also, like I said, adding to my age, I feel like there's just this assumption as you get older that things are going to go wrong and you're just going to deal with it. And I had
Yes.
one doctor tell me that I didn't need to make the second doctor told me I didn't need to make another appointment. And I felt like it was you're going to just have to suck it up. And someone in, I don't know if it was the first or second doctor, actually used those words.
Yeah.
I feel like there has been a change in the medical profession. One of the reasons I started this podcast is getting patients' perspective on things are not where they should be when it comes to experiences for patients. And so I'm not imagining that, right?
No, you're certainly experiencing medical bias, and that happens when a doctor looks at you and forms an opinion about you immediately. And in that moment, they also kind of decide on your worth. You're like, is it worth it to go through the rigmarole of ordering all these things for a patient, or what is the most likely scenario that's going to happen? And they start to see you more as a group than as an individual, which
Yeah.
can be super frustrating. And so your medical bias, as you're saying, the insurance is not as great. We can't pretend that that doesn't exist, that you don't get different care when you have different insurance. And then you're also a woman. And then it again totally happens is as you get older, there is an expectation of the amount of pain that you're supposed to have. So you're definitely experiencing medical bias, and that really is the funnel to medical gaslighting. So I just want to reassure you that's very real and does happen.
As we're speaking, I'm trying to look up this term that I heard someone say in the medical profession. They have an acronym for a middle-aged woman. And I can't, you know what? I'm going to have to find it. I'm going to try to find it, Lana, before our conversation is over. But there
Mhm.
is actually a term that some medical students are exposed to. And it's kind of like the equivalent of a middle-aged woman just complaining.
Yes, I've heard the story, and I can't remember the acronym either because I'm also getting
Yep, and well, you've heard it, and for those who haven't, I'm gonna really try to find this, but it's disheartening to know that, like you said, there is a preconceived notion before the doctor even walks in that room, because they've been "warned," quote,
Mhm.
unquote, about the woman in there who's probably just complaining, where women express themselves just naturally more, traditionally than men. So if you're a male doctor who is not respectful or understands how a woman processes things and then
Mhm.
goes into the room as it just, to me, it's like this is not what medicine is supposed to be about. So I want to get back to your book where you write that awareness of medical gaslighting isn't enough. So I want to ask you, what is missing right now in the conversation about this topic?
I think the thing that's missing is the conversation. I think that again, we have this overarching idea of what medical gaslighting might be, but and the whole reason that I wrote the book was so that we could nail it down. Because once you nail it down, once you know what does it sound like, what is it meant to do, like what is the purpose of this, why does it happen, then you can do something about it. But until all women in this country are so familiar with the way that they can be ignored and dismissed, very little can be done. So really this whole book was about nailing down those definitions, ways that we see gaslighting, like purposeful obstruction when a patient's care is deliberately impeded by a healthcare provider, or medical negligence when there's a situation in which a patient receives inattentive care or care that fails to fully provide a diagnosis or treatment, or there's a manipulation in the power balance where we see that a lot with male providers, female patients. And then, like you experienced, treating patients with outstanding bias based on their age, their sex, their gender, their religion, their lifestyle. There's so much that really we can be biased against. And all of that kind of leads into claiming hysteria, where any reaction that we have to medical gaslighting is then weaponized to make sure that we don't get the care that we need. So really the whole book is a way to understand what is happening, why it is happening, and then what I wanted to do, which was completely different from any self-help books, any articles that I had read, any interviews that I had heard at the time, was fight back.
Yeah.
What does it mean to fight back against medical gaslighting, and how do we do it in a way that has so much dignity and so much calm that we completely obliterate what medical gaslighting is? When we come out completely opposite as hysterical, we come out with facts. I just felt like we couldn't get there until we saw the entirety of the maze.
I have an 11-year-old son, and I recently had to take him to urgent care because he ended up having the flu. But he
Mhm.
had this high fever, didn't really have any other symptoms. And I said, well, we need to figure out what this is. And, basically, let's just go. They do a battery of tests and they'll tell you which one it is. And as we were walking out the door, I don't know how it came up in conversation, but it was like, yes, the person who doesn't feel good has the burden of getting in the car and having to go. And I said, there was a day when doctors came to your house, and somehow it's turned into their convenience as opposed to your convenience. That also to me has brought about the impersonal relationship that you can have with a doctor, where if they're coming into your home and seeing your home and meeting your family and knowing where you live, back in the day, smaller communities, they knew their patients, where now, it seems like it's more of a corporation where it's just you're funneled in, you're funneled out. And it, unless in my case, unfortunately have a chronic or terminal illness, that's the moment you really get to know a specialist, right? And then you
Right.
develop a relationship that you don't necessarily always get with a primary care physician or a general doctor. But let me give the good doctors credit. How do you distinguish, the scenario of me coming into the doctor's office and I maybe in my mind thinking I know what's wrong with me, or when I took my son in, what if if I was that parent who just knew what was wrong with my son, and the doctor, who's a good doctor's like, I disagree with you. Like, my prognosis is different than what you think you have. What is the difference between disagreeing with a patient and actual gaslighting?
Oh, that's a good question. So one of the things that I try to teach in the book is transparency of care. And that is this whole idea that we have a medical record, and bear with me because I know this is far away from
That's
from the
right.
topic, but
Sure.
I promise you it's there. We have our online medical records. It's accessible to us now so much more than it was even 5 years ago. And we have the ability to go in and see, what are our doctors saying about us? What are they writing about us? And we have the ability to really use that to our benefit. We can go in and start having conversations that are collaborations that are coming from like, hey, like I read the notes, I see what you're thinking. I'm looking at the history that you're looking at, and we both see the same blood test results. We both see the same, exam results. And starting from a place of having that same information, of having transparency of care, puts you in a much better position to make that case for, well, I know myself and I know my son. And this is why I think that this is what's happening versus what you think. And the book goes through different ways to kind of go through that conversation and make your point and be heard. You spoke about doctors in olden days coming to your house and
Doing
being
house calls, right?
yeah, well, being more one-on-one and knowing who you are. And the reality is that in today's medical system, there are concierge doctors that do that. If you wanna pay them, $10,000 a month, they will do that. But the reality is that most of these doctors have patient loads of well over 500 to 1,000 patients that they see, and that's too many. It's simply too many patients to ever form a relationship, to ever trust anyone, and the amount of time that they're seeing these patients, 20 minutes max, is not enough time to form an opinion. So they are rushing through trying to form an opinion on who you are and why you're here, and also listen to you while they're looking at every context clue. There are all these causes that when I was writing the book, I was like, well, why? Why is this happening? I know that doctors don't wake up in the morning and drink their coffee and say, I'm going to go gaslight a patient today. Like that can't be what happens. There's got to be more reason to why doctors all over the country act the same way. Like, does it go back to medical school? Is there something that they experience that puts them this way? And there really are a lot of reasons why doctors gaslight patients. And the number one is the overburdened physician. That's just the reality of doctors are burning out. They were burning out long before COVID, and they're continuing to burn out. Their firms are being bought by private equity, and they are just stripping them of resources. And this is not to say like, okay, that's all right then. Then you can treat me like crap. Like I said, there's a couple causes. So there's the overburdened physician, and then there's implicit or unconscious bias. And we touched on that a little bit when we talked about being judged or feeling like your hair is being judged within the idea of what kind of insurance you have or what your age is. And that is a very real thing. So there's implicit or unconscious bias. And that's again when a healthcare provider stereotypes the patient, develops an opinion about a specific patient, and they might do that by observing their files, like, what kind of job do they have, or how old are they, or again, age, weight, sexual activity, anything like that. It can also come into play like when you describe your pain and symptoms. And again, this is doctors acting on the experiences that they have, and they're not great experiences.
Yeah. Are you at risk of having a stroke or heart disease? Lifeline Screening offers an affordable package of preventative health screenings to detect your risk factor. Screenings are easy, painless, and non-invasive, and located in your area. Click our link in the show notes to schedule your appointment. Are you a professional caregiver? Help us understand your perspective. facinginwardpodcast@gmail.com. I had a couple doctors too, specialists in the past, who were approaching retirement and went ahead and took their retirement because of the influence that insurance companies were having upon their practice. So when you talk about, 8,000 patients, it's like tell me if I'm wrong, but the doctors really got to a point where to make the same amount of money they had made in the past, they had to double their workload. So insurance companies is another love-hate relationship that I've developed over the years. Healthcare turning into, it's always been, I guess, a money maker, but it just seems like turning it into just I don't know, like they're not hiding it anymore. The fact that you are nothing more than a number, a
Well,
dollar amount to them.
they're not hiding it because they're not in charge.
Yeah.
I know so many doctors that are with the nurses on their strikes and are going on their own strikes, but really they don't even have time to strike because again, yeah, it's exactly that. It's their career has become there is no downtime, there is no free time. There really wasn't before, but there's definitely not now. And yes, I agree. It's definitely one of the causes of doctors not treating patients with respect or giving them time or just taking the time that they need. It's definitely one of the main causes of being gaslit.
I'm not going to get into politics, but my thought was that leadership is not very healthcare from the patient's perspective friendly. And just the debates about what's real and what's not just make me realize we're going back to that, and where we could have access to such incredible technology that could really bring patients of chronic and terminal illnesses back to better health, but that's not what we're focused on. And so it's hard as a patient to keep your chin up because it feels as if you're getting lost. And like I mentioned earlier, the older you get, the more you feel lost because people just assume, well, you're breaking down anyway, so you need to kind of expect that.
You're in a battlefield. And one thing that I definitely don't do is sugarcoat and reassure people like it's okay. It's not really happening. It's not that bad. No, it's really that bad. Is that bad? And another reason why I wanted to write this book is so that you can be on guard. When you walk into a doctor's office and you're there because you have something that is destroying your quality of life or potentially your life, you need to be in active mode. You need to be in fight mode. You need to be ready to prepare yourself. You need to be prepared for the arguments that you need to make. This is not some figment of your imagination that we're not getting good care. We're not getting good care. Even if you have a doctor that does the due diligence and sits with you for 20 minutes, that's nice, but that's not everything. You still need to be the very active player in a two-person role.
Let me talk about something you mentioned, which is mastering electronic medical records.
Mm.
So most patients don't even realize that they can access or even amend those. So talk a little bit about that and why people may want to understand that they have access to these things.
Yes, there's so many patients that I speak with that they walk out of their appointment, they get the little notification of like, "Hey, here's your MyChart notification, your clinical summary has arrived," and they just don't go in there. And it's so important. It's so important that you go and look at your medical records because even if you go into a doctor's office, you think, "Oh, this was such a nice interaction. They really understood what I was trying to tell them." You go home, you look at those medical records and the clinical summary of what just happened. It has no relevance to you can't even tell that it was the same appointment that you were both in because the assumptions and the final summary are completely different from the reality of what you perceived during that appointment. And that happens way too often. There are reasons to look in your medical records like, yes, they have all your allergies and they have all the medications that you take. And definitely you should go in there and make sure that everything is accurate. But really, it's about having this long-term relationship with your doctors and your specialists, that when you go and look at the notes, they're talking well about you. They're making sense. There's not any hidden notes in there that are, derogatory, that when the next doctor receives it and you go into their office, they're then operating from the bias of the previous doctor.
Mhm.
And I would say the majority of the country's healthcare is on MyChart, which is an Epic system software. And any companies that are not yet on Epic, they will be on Epic. It's becoming unaffordable not to be on the Epic system. It's really important after every appointment that you are going into your medical record and reading about what just happened and making sure that it aligns with the reality of what happened during that appointment. And that's so that you don't get sideswiped by a diagnosis that is mentioned but was never told to you. Or maybe there's something derogatory in your medical record saying that you were not cooperative or something like that, that again, when you get passed on to the next doctor, they see that note and it entirely changes how they walk into that appointment with you.
Yeah.
So it's our fire alarm for medical gaslighting, as we see so much of it in the medical records. So I really do try to get everyone to look at that, because it is your right. It is part of HIPAA that you are given access to your medical record pretty much in its entirety, and you have to be the keeper of that. And there are ways to edit things within it. I've really done more work on that this year after the book came out. I did write about it in the book, and I did write a whole chapter on it, but I really wanted to test the system myself this year. And like I said, I always go on, I have MyChart, I look at all my notes, I think everything is there. And then I had a hospital stay earlier this year, unfortunately, in the ICU. And there was something that was mentioned by one of the nurses. And I was like, that's not in my notes. I'm looking at the same MyChart that you're looking at. And she's like, not quite. And I was like, interesting. I did what I suggest people do in the book, which is I wrote to the medical records department of the hospital that I was in, and I requested the entirety of my medical records, including all notes from doctors or nurses. And when I received that, I finally saw that there were missing pieces that wasn't showing to me in my patient view portal. That's like next level advocacy, is first access your medical records so you can see the basics. And then if you really want to see what's in there, query the medical system that it's coming from, get the full records, and be amazed that there are even more notes that are being kept from you.
I have a friend who's a medical malpractice attorney, and so I'm aware because that's what they do, is they go in
Yeah.
there and they're with a fine-tooth comb looking through all that if something has gone terribly wrong. So moving past the medical records, is there one story in the book that still stays with you?
Oh God, all the stories stay with me. I wanted the book to have a very patient forward voice, and I didn't want it to just be my voice. I did talk a little bit about my story, but I wanted for just about every chapter for there to be a patient story that really aligned with it. And so I did close to 100 interviews with women from all over the country and the different things that they experienced, and how medical gaslighting impacted them. And I found so much of myself within them, which was wonderful and awful. And I think that the readers that have spoken to me about their experiences with the book, the real life stories really did stick with them. But there's a lot. I mean, for instance, there's one story where this poor woman, she's having terrible abdominal pain. She's being told she has an ovarian cyst. She's like, I don't have ovaries. I had a radical hysterectomy, and they don't believe her. They don't believe her. And of course, she has appendicitis. So that's one of them. There was another girl, a victim of the unfortunate misinformation that we were getting about opioids in the early 2000s. And she was prescribed very heavy duty opioids as a teenager, as a 15-year-old.
Oh,
And the way that her story played out after that was gruesome, but so necessary to see and read about just how she was treated in the system, and all the little things that led up to what was an eventual amputation.
mm.
It was a very difficult story to listen to. There were some other very difficult stories to listen to. I did make sure that I put in trigger warnings for people reading the book. There is one chapter that has a mention of sexual abuse by a healthcare provider. It was very difficult to hear that story, and very necessary that it was included. And I'm so grateful to the women who shared all their stories and all the situations, which were so relatable, and again, equally as horrifying. And I'm just so grateful for all of them for for not just going through what they went through and surviving what they went through, but knowing that it was important enough to continue to share their stories with so many people.
You're vulnerable, you don't feel good, you're scared, you're confused, especially if you have a serious condition. And then
Mhm.
for someone to take advantage of your vulnerability is just the most offensive thing in the world. Having the conversations is important
Mhm.
because you can take some of that power away from that and let people know that you're not the only one and there's people to talk to and there's people that are here to help. And I'm a glass half full kind of girl, and I don't want people to be afraid to get sick. I mean, that's the problem, is that we should be allowed to not feel good. We should be allowed to get sick, and we should be allowed to be in a space, in a safe space in which we can get better. My next question to you is, how should medical schools be training future doctors differently?
This is a great question. I actually spoke with the head of the women's health department at the NIH, and we talked about this for a while about continuing medical education and our understanding of what's being taught in medical schools. And I did interview, I think, 3 different medical students while writing the book. And it continues to be a very cutthroat environment in medical schools. And we are repeating history because we have tenured professors who are teaching the same patient care tactics over and over again. And, I think part of our hope is like, well, those professors will eventually retire and new ones will be brought in. But I think there's so much more that we can do both at the medical school level and then further than that with continuing medical education. And that was one of the things that the NIH is talking about, is creating courses that specifically target medical gaslighting and medical trauma, and teaching doctors how to speak, how to have conversations, how to recognize their own bias so that they stop repeating this behavior. But it's definitely something that is like a sickness that starts in medical school and trickles all the way down for years and years to come.
Well, again, your conversation with them, their awareness of it, I mean, it's never in the time we want it to happen, in the time frame we want change to happen, but change is inevitable, right?
Mhm.
And, it was just recently, and I'm going to botch one of these stories, but female tissue has not been used for very long when they're doing studies on different diseases and stuff. And they've just now, in the past, 20 years, have started
Yes.
to use, female tissue in that to understand that there may be a difference in the treatment for women. And then on the other hand, you also have the NVIDIA settlement with Henrietta Lacks family, right? I mean, this has been something going on for half a century. And if you don't know that story, it's an amazing, amazing story. I mean, I'm here because of Henrietta Lacks. My son, who
Mhm.
is an IVF baby, is here because of Henrietta Lacks. If you don't know who she is, you need to look her up because she deserves statues and all the accolades. But she was also taken advantage of by the medical community. Her story is amazing. But again, here we are where those medical communities, it's still not everything that family's owed, but it was an author who wrote a book who got awareness to the point of that family being able to get some kind of payment for all those years of not getting anything, where the medical community got quite a lot off of HeLa cells. And so the same with you, with your book and bringing awareness to this. And I really do appreciate you. I mean, I could talk to you all day about this. But I do want to ask one more question, a final question, because I respect your time. And that is, if someone is walking into a doctor's appointment tomorrow and they feel utterly powerless, what is the one sentence you would want them to remember?
The one sentence I would want them to remember. No part of this is personal.
Mm.
And I say that because this doctor doesn't actually know you. Their lack of care is about them, their biases, their education, and their time. It is not about who you are as a person. If you can have the dignity to understand that, then you can go on and you can do exactly what you did, which is keep seeing the next doctor and keep seeing the next doctor until you get the answers you deserve.
When I was going through my kidney failure in my 20s, when I finally got with a great doctor who ended up saving my life, I love the fact that she was able to say, I don't know. So when
Yes.
I was obsessed with why is this happening to me, she was able to tell me, I don't know. And I respected her immensely just for saying that, right?
Yes. Mhm.
There are some things that we as doctors just don't know. But her main thing, which I use as a quote on the back of my book, is instead of asking why me, you got to ask what now, And
Mhm.
that was her response to that. And I was like, okay. And then from then on, we formulated a plan how we were going to extend my life. And here I am 20 something years later because of it. So there is hope. There are things out there. And Ilana, like your book, I mean, people need to get their hands on it. And we'll have a link in the show notes. And that way they don't feel alone. I mean,
Yes.
I have one more question, Ilana. I am curious about the catalyst. What was the moment you decided I have to write this book?
I had done a video on TikTok where I'd shared uh, a post that I felt was really average about medical gaslighting, about going to the emergency room and bleeding too much and having the doctors just kind of ignore me or honestly shame me about coming to the emergency room for something like that, even though that's exactly what we're told to do if we're bleeding too much. And I went through this kind of like laundry list of things that I wanted to be tested for, that I wanted to understand about my body. And I literally made the video in like I like had the idea for it and then made the video on the spot in like 2 minutes. And that video I think has like 9 million views now.
Mhm.
And it just became this like, yes, and this happened to me and this happened to me. And the comments, thousands and thousands of comments just talking about how normal of a scenario this is and how many times it's happened to women. And I think it was very hard for me after seeing that to think that there was anything else I needed to write about but medical gaslighting
Yeah.
right now.
Well, thank you for your voice because I think those of us who have the ability to raise our voices, we understand we're doing it for, I mean, hundreds of people who don't have either the courage or the capacity to be able to raise theirs. So, Ilana, thank you so much for not only being part of the podcast, but for the efforts that you make to help others.
Thank you.
Ilana's book, Medical Gaslighting, is available wherever books are sold. Facing Inward is an extension of my book, Facing Inward, also available anywhere books are sold. This podcast is a production of Wanking Dude Publishing, all rights reserved. Thanks for listening.